The COVID surge in India is in its second wave. Hospitals are running out of oxygen. Mass cremations are occurring in city streets. Dr. Giridhara R. Babu says despair is creeping in.
The situation is grim and very concerning. One of my younger colleagues broke down because he could not admit more patients because the beds are completely full, and he kept sending the patients to other hospitals. So there is a sense of hopelessness in most people, but then we have to regroup every day morning. People get up and get back to work to save as many lives as possible.
There were over 2,700 deaths and nearly 350,000 new cases just on Saturday. And that's generally accepted to be a gross underestimate because testing rates suggest that many cases are going undetected. Many countries are suspending travel from India, and there's no sign yet of the curve flattening.
I actually truly think this is on a scale larger than anything we've seen so far during this pandemic. It's a calamity. It's a disaster.
Cases were already rising rapidly when the Modi government allowed the Hindu festival of Kumbh Mela to go ahead, with huge numbers of pilgrims gathering on the Ganges.
So I think one of the main drivers has been complacency. I think when the cases came down off that first wave peak, there was a very relaxed attitude in India. Things started to look very normal.
To put India's response in perspective, Victoria's second wave last year peaked at around 700 cases a day and went to a stage 4 lockdown for 112 days to get it under control. New Delhi, a city of over 20 million people with over 20,000 cases a day, has just announced a 6-day extension of its lockdown, while facing such a crisis over oxygen and drugs that the international community is having to fly in supplies. Then there's the virus itself. India has new variants of the coronavirus circulating, one of which some believe is more contagious and vaccine resistant.
We don't have a lot of information about this new variant. We don't know whether it's more virulent. We don't know whether it's more transmissible. But what I can say is that even without this new variant, we had such strong drivers for disease transmission that this would have occurred anyway.
The task of vaccinating the almost 1.4 billion people of India is daunting. So far, despite nearly 140 million doses being administered, only 1.6% of the population is fully covered.
Vaccination can't bring transmission under control of these heights, and so we have to go back to the basics that have worked ever since this pandemic started.
India will need help to get the pandemic under control. Australia is considering what humanitarian support it can offer, but has also slashed flights.
I'm really torn about this issue because on one level, we know we have problems with hotel quarantine here, and any time we bring people in from a high-risk country, we increase our own exposure to risk. But at the same time, we're talking about Australians who are effectively in a war zone, if you like, and whose own lives may be at risk.
What happens in India will have a lot of relevance in terms of COVID-19 response all over the world, mainly because higher circulation anywhere in the world is a threat to COVID-19 control in every part of the world.
The danger for Australians is that we look down our noses at the way India has dealt with COVID. We need to help India as much as we can, not just in our own interests, but in recognition of its human suffering.
I hear and see too many sad stories. I'm just trying to keep myself composed, calm, so that I get to work on what I'm working, and not the sadness around takes away my energy. So it's about self-preservation in how best you can contribute.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.